leadership responsibility at the head of the agency to mediate those differences, right? To control for the political stuff coming downhill from the department and the White House, and also being able to work with the center directors and work with your scientific leadership. I mean, I think that just demands somebody who has a clinical or scientific background.
Hello, welcome to this very special episode of FDA Watch. Today we're going to be covering the resignation of Dr. Marty Makary as commissioner and the ascension, if I can use that word, of Diamantas to the role of acting commissioner. This has been one of the most interesting times, I think, in FDA history in terms of the leadership of the agency. Dr. Makary went through a week of agony as the press was reporting that he was about to be fired, that he was about to resign, and finally he resigned. So lots of changes coming. Two guests today, both of whom have been on FDA Watch before. I'm going to introduce them both briefly because they're well-known names in the FDA community. Paul Kim, Kendall Square Policy Strategies, former congressional, former FDA. Stuart Pape, Polsinelli, former FDA. Stuart and I worked together starting when we were children. It must have been, because if you look at the years, it must have been Stuart when we were children at the FDA together. Stuart, of course, was Associate Chief Counsel for Foods, Special Assistant to the Commissioner. Let me start out with my view of this. Makary certainly was the most flamboyant of commissioners. And if you look historically at the way that commissioners, I'm going to use the word behave or act publicly, flamboyance is not one of the characteristics of the way that FDA does business. The vast majority of people there are ultra well trained. Many physicians, lawyers, other professionals, but flamboyance is not a characteristic of people who work at FDA. He unfortunately entered on April 1st, 2025, just as DOGE, the Elon Musk people, had cut back FDA staff substantially. The latest numbers are that there are 4,500 fewer FDA employees now than there were a year ago, and he was faced with the DOGE cutbacks, much of which he had not orchestrated himself. He started out by criticizing a lot of the FDA staff, and that wasn't a good way to start out. Plus, he came in with no managerial experience to speak of. He used to be able to manage an operating room. He was a surgeon at Johns Hopkins, but he had no managerial experience and no political experience. And for an FDA commissioner, you need at least some of that, where you need to make sure that you bring in people who have that kind of experience, and the people that he brought in did not have that kind of experience. He also, of course, had very strong president and a very strong secretary of HHS with strong views about FDA. President Trump especially, because during 2020, during the beginning of COVID, Trump personally, you may recall I was at FDA there at the time. President Trump learned a lot about FDA and about how it had functioned. So you see that being played out now because you see a lot of pictures of Makary and Kennedy in the Oval Office dealing with issues. So what I want to talk about today with Paul and Stuart is not necessarily what went wrong, but I want to look to the future. We have a new acting commissioner, Diamantas. I want to discuss what programs that Makary initiated are likely to survive. I want to understand better what it means for all of the various stakeholders, the various constituencies that FDA deals with. So with that introduction, let me call Stuart, and I'll ask a very simple question. Stuart, what's your take on this?
Well, look, I think Dr. Makary came into FDA as a man on a mission. He'd written several books that were very much contrarian, often right, but contrarian. And I think he came in with a self-initiated, but I think probably reinforced by people around him, the secretary and others, to make as much change as quickly as he could. And that, in his own predilections, caused him to routinely bypass process. He didn't build support for initiatives with internal constituencies or external constituencies. He didn't engage in rulemaking. He announced, I can't remember a time when this happened. Wayne, maybe you can. He announced new policy issues by journal articles that often were published within days of being submitted. So, you can't say they were peer reviewed because they were announcing a new policy. And I think ultimately that caught up to him. Look, I think being FDA commissioner is one of the 10 toughest jobs in the government. You have enormous responsibility. You have a universe of powerful stakeholders. You have much more responsibility than you have resources for. So I can understand why you might think process is your enemy, but at the end of the day, process is your friend. And I think that that's where Makary ultimately sort of tripped up. So what do I think Acting Commissioner Diamantas is likely to be? He's a lawyer. I have often said there are very few jobs in the federal government that lawyers can't do capably. I happen to think commissioner is one of them. I think Kyle will do a perfectly good job on an interim basis. He's politically astute. He's close to the Trump family. He's hunting buddies with Don Jr., so he has that going for him. I think he is likely, both because of his observation of Makary's tenure and because of his own instincts as a lawyer, is likely to rely more on process and to initiate things with a process. He's done, by all accounts, a great job reaching out and connecting with the food side stakeholders. And so I think he's likely to continue to do that. I would wager that he is acting at least until the midterms.
Paul, let me ask you the same question. What's your take? And then I want to double back on what Stuart said.
Yeah, I think, Stuart, you've really touched on sort of the important test here for this acting commissioner. We have gone through such a tumultuous, 15, 16 months. It feels like 15, 16 years. We've been lurching from leadership crisis to leadership crisis. And, to your point, Wayne, we do want the FDA to be less flamboyant. We want to make FDA normal again. And, this acting commissioner, what troubles me is that, look, there is this vacuum in scientific leadership across the agency and across HHS right now. We know that. We see the struggle they're having trying to find people who, have that experience, Stuart, that you mentioned, clinical or scientific. And because of that, they're getting lawyers to do the jobs that really should be done by clinicians or scientists. And I think that's concerning, because the Vacancy Act, right, is very clear about who can be acting commissioner, or in the case of any federal agency, the acting head of the federal agency. And in the past, when you mentioned the first administration, the first term, Ned Sharpless, stand-up guy, no doubt, and exceedingly good scientific leader, along the criteria we just talked about, he should never have been named acting commissioner under the Vacancies Act. He didn't qualify under the statute.
Just for the record, he was the head of the National Cancer Institute. I just want to, for our listeners, just know who he was. Go ahead.
Yeah, no, exactly right, Wayne. But he wasn't first principal at FDA. He was not in a Senate confirmed position, although I always thought NCI director was, but in fact it's not. And he wasn't at FDA. So, if the administration is playing it fast and loose with these kinds of rules, I think, Stuart, it's possible we'll see him pass the 210-day threshold, which Dr. Sharpless, to his credit and the administration's credit at the time, he did step down at 210 days. But, I really don't know that those norms, necessarily still hold.
I want to shift gears a little bit and ask both of you. We all three of us served at FDA. Stuart and I served together under a number of commissioners. Does it really make a difference who the commissioner is? We know what the commissioner does. The commissioner is not approving new food additives, not approving new drugs or devices, is not involved or should not be. In this administration, of course, they have been more involved than customarily. So a lot of what the commissioner does is outside of the agency, dealing with the press, dealing with the Congress, dealing with the White House. So, Stuart, let me ask you from a consumer protection standpoint and from the overall day-to-day operations of the agency, does it make any difference?
Yes, I think it makes a lot of difference. The commissioner sets the tone. The commissioner protects the career people traditionally from excessive political intervention. The commissioner permits them to do their job, defends them. Look, this is one of the places I think where Makary made a mistake. His first talk to employees was a disaster, right? Because I don't know, this is my take. He viewed them as antagonists, not part of his team. And so, yes, I think the commissioner sets the tone. The commissioner keeps powerful stakeholders on an even keel if the commissioner is doing his or her job. The commissioner helps the agency navigate administration, executive branch politics, because there's lots of pressures. If you're the FDA commissioner, the Secretary of Agriculture has a view about how you're doing your job on the food side. So does the head of NIH. So might the head of CDC, if we had a head of CDC. So might the Surgeon General, if we had a Surgeon General. But all of those people, the head of OMB, the chair of the appropriating and authorizing committees, all of those folks have a view about what you should be doing, and the commissioner has to navigate all of that while permitting the people at the agency to do their work, to inspect facilities and review product applications and execute on enforcement policies and develop guidances and regulations. So absolutely.
Paul?
Yeah, I agree with you entirely, Stuart. I think that the leadership responsibility at the head of the agency to mediate those differences, right? To control for the political stuff coming downhill from the department and the White House, and also being able to work with the center directors and work with your scientific leadership. I mean, I think that just demands somebody who has a clinical or scientific background. And I will say, not just outside in, but inside out, but outside in. For many, many years, for decades, I think this is a fair characterization in the Senate, across both sides of the aisle. It was well understood that if there was a short list of nominees, and these are short lists that I've seen before, I know you guys have worked to develop those lists as well for the commissioner, you wanted somebody who had to be showing that leadership, the institutional leadership you mentioned, Stu, but also, had that background, had that training. It was just assumed, Wayne, I think that was true. And I don't see why we should be departing from that.
I'm going to ask you both to take out your crystal balls, okay? Give you a second to do that, starting out with Paul. There have been, I think, more changes initiated by Makary in the drug area than in any other area. I can begin a list of the voucher program, the pre-check program, the desire to have more domestic manufacturing, changes in the way the clinical trials are. We can spend the whole podcast, and someday we will, talking about all those changes. But my question to you, and I'm going to ask Stuart the parallel question in the food area: what changes are the most important? And in your crystal ball, what are the changes that are most likely to survive this next leadership change and whatever change of administration eventually occurs?
Yeah, there are three things I think I would point out. One is, and this is just because I spent a lot of time thinking about orphan drugs, the rare disease policy, the plausible mechanism, evidence framework, the push to sort of do more through the hub and through the centers for small n and F1 diseases. I think that should be sustainable. We've seen extraordinary clinical success with baby KJ, of course. and we want to recapitulate that. We want to scale that up, and it doesn't hurt to know that people are more and more aware of the incredible successes in clinical development in China. So that helps for us to frame this question of, shouldn't we be pressing the pedal down even further for that? So I think when that's sustainable, it should be, there are things that can be done to support those regulatory policies with investments and follow-ons, through other parts of the government. So that would be great. The other part of it is, like, you looked at fiscal year 27, the president's budget didn't take an axe to the agency, right? We didn't see this sort of Doe style, let's burn the building down kind of policies. So I'm hopeful that that too will sort of be a straight line extrapolation to the remainder of this term, and fingers crossed. And the last thing I would say is the third and last thing is just that, we're entering into the phase where PDUFA 8 is just being finalized now between industry and the agency. Now we're entering the conversation with Congress. And so for all the reasons, Stuart, that you mentioned, and Wayne, we've talked about needing scientific clinical leadership at the head of the agency, that's going to be something that I think is a question mark, Wayne, where it's not so much sustainability and durability, but there's an open question here about, like, well, how well will the agency navigate this process over the next 18 months without somebody who is Senate confirmed and a scientific leader?
Are you concerned that a lot of the programs that have been initiated, the voucher program, the one study standard, the use of real-time clinical trials, none of that is in regulation? A lot of what you're doing, and in the food area, and I'll ask Stuart in a second, a lot of what has been initiated is not in regulation. And for non-lawyers, what it means is that the FDA has not formalized these policies. As I think Stuart mentioned, a lot of them came through YouTube or from other pronouncements made by the commissioner. Are you concerned about some of these initiatives being able to survive, given the fact that they have not been institutionalized in a formal way?
Yeah, say, Wayne, and Stuart, I think you're exactly right. Launching 1,000 ships through press release is not a way to create durability and integrity for your programs and new ideas. And Wayne, I think Kyle, or whoever else succeeds Kyle, has this opportunity to go through the regular normative processes and really give these things foundations. Real time, I think, is really really quite promising and excellent. The AI initiatives really quite interesting. A lot of question marks, but very interesting. So I think that's exactly right. We are hoping and looking for them to go back to normal practice, because we'll know what to expect. We can actually comment on things, like we can actually have a docket where there's eliciting our views. I think that'll be a net positive.
So, Stuart, let me go back to the crystal ball question. A lot of initiatives have come about, of course, with Kyle Diamantas being the acting commissioner. You would presume that he would continue to push for his initiatives. What do you expect, the future to look like for human food regulation?
Yeah, well, so I certainly think he'll continue to push the food-related agenda that he's been responsible for thus far. The one of the dilemmas he's going to have, of course, is his plate just got loaded up with a whole bunch of other interesting things. So he's going to have to find a deputy, if you will, who can run honcho on the food stuff. My view is, and this is not limited to food, I think one of the reasons that he was made acting commissioner relates to the midterms, because everything FDA does between now and November is going to be viewed through that political lens. Does it help or hurt Republicans to get elected? And so that's not a particularly easy road to navigate. What is Kyle going to do about mifepristone? Just to pick one example out of the air. That's apparently one of the issues that part of the president's constituency, the right to life people, were aggravated about, right? What's he going to do there? There's a mifepristone case pending at the Supreme Court. What's the Supreme Court? So Kyle's job, from my perspective, is to look at, and he's I think an astute political actor, to sort of look at all those things and maybe defer or deflect when he can, or act when he needs to, when the agency needs to, in a way that is appealing to the Maha crowd. And that's, he's got a proposed regulation relating to grass that's been at OMB for months, that he has said repeatedly does not have problems at OMB. But it's been there an awful long time to not have problems. So I think if I'm at OMB now, I'm taking another look at that, and I'm saying, does issuing that proposal help or hurt with the constituency that we need to get to the polls in November? And so I think that's going to be true of everything that they're doing at the moment. And look, if you've ever, when you and I were at the agency when midterms and elections came up, and typically the word came down from OMB, not just to FDA, but everywhere, don't do anything politically stupid. And if you're not sure whether it's politically stupid, it's politically stupid.
Stuart, you and I were there during a number of commissioner transitions. So let me ask you, from your perspective, what's going on at the agency right now as the agency is undergoing a commissioner transition? What's going on?
Well, the career people are doing what we're doing, right? They are all discussing with their colleagues, what does this mean? Is this Makary initiative going to survive, or can I stop worrying about it because I was given some impossible task? So there's all that kind of thing. I at the moment, I suspect there are no answers. If I were advising Kyle, I would tell him to have an all hands meeting soon, steady the ship. As Wayne, you and I were co-authors on a piece that appeared shortly around the time that Makary was appointed, and we advised, among other things, to work with the career staff, rely on the career staff. Those are the people who know these issues, can help you get initiatives through. That's obviously not what happened. If I'm Kyle, I take a step in that direction if I can.
Okay, Paul, any perspective on that?
Absolutely. In a nutshell, Louisiana versus FDA is a case in the Fifth Circuit where the state and other states were alleging that the availability of mifepristone as an antibiotic in the mail order context it was actually, pursuant to the REMS, actually overrode Louisiana's sovereign power to regulate abortion. So they set up this conflict between FDA's authority and the authority of the states to regulate post-Dobbs the conditions for abortion. And the Supreme Court did take cert, so they will be deciding on this case. And the agency will have to make a determination. Like if it goes back and remand and the court decides, that mail order, that can't stand. We can't have that kind of distribution. Then the agency actually has to decide what the labeling of the REMS says. So to your point, Stuart, you're exactly right. Like the agency is going to have to step up to that. Now, whether it's before or after midterms is another issue entirely.
What's remarkable in that case is that the pending matter before the Supreme Court, the Department of Justice did not file a brief on behalf of FDA.
Yes, exactly. Yeah, that withdrawal, basically. It's like, I have the high ground. I'm going to go take a walk and cede it. Yeah. It's untenable, right?
Yes.
Hey,
yes.
The other part of it is like, if Kyle does that in all hands to it, I think one of the things that he should double down on, and when you were talking about durability and what things are sustained and maintained post Marty, would be that training initiative and the hiring initiative. We lost all these people. It's an irrevocable loss, clearly, to the agency and its capabilities. So I'm going to double down. I'm going to really focus on getting more and new people in, right? Maintaining integrity, retention, because we've been losing people. I don't know if everyone's aware of it, but we're losing people at the centers as we speak, as they try to hire. So those are things that, from a managerial experience point of view, absolutely critical in top line.
You both have clients. So I'm one of your clients and I'm calling you up. Start with you, Paul. and I say, I'm reading the newspapers and all the press. What should I do? What am I supposed? What should I, as let's say a drug company, what should I be doing differently today than I was doing last week?
I would imagine everybody has been aligning their advocacy towards the agency, with an idea that Dr. Makary was there, right? And now with that different, you're talking about a different individual, but you're also talking about everything is a jump ball, Wayne. Exactly. The whole premise for this conversation we're having, let's see, what can we ask the agency to focus on, and by the way, I saw that there was that letter from No Patient Left Behind, the coalition, calling for Dr. Pastor to be named, right, nominated as commissioner. I'm not sure Dr. Pastor would want that if he was asked, just like Dr. Hahn, but I think, Wayne, that would be the first thing. Like, let's talk to the administration, White House personnel, let's talk to the department and the agency about, like, who should be the commissioner. Let's talk about that. And what are we going to ask for?
So you would advocate to a client within limits to be fairly proactive in trying to influence what happens at the FDA next.
I think so, because what we are looking for in a commission, whatever qualities and experience and characteristics that he or she will have, are ones that rebound across the agency. We're going to look for scientific integrity and independence. We're looking for managerial competence, all the things that we want across. And with that loss of senior careers last year, we're really looking for them to try to fill those gaps as well as get one person named to the top.
Stuart, I'm a food client. What should I do?
Well, most of what a food client is worried about is the routine interaction. I'm working on a food additive application. I have an application for a cultivated protein or some other kind of thing. I think there it's just business as usual because none of this is really there. I think where this gets complicated is if you are working on something that it relates to a policy that was under consideration or being revised in the commissioner's office. That what's been added to your calculus now is a hefty dose of uncertainty. And so it's not at all clear how you play that. Look, on the grass rule, which is driving many food industry clients to pull their hair out, there are states. New York State just passed a grass bill, which is on the governor's desk, I think. So, I don't see anything here that suggests that this change is going to alter. That's a priority of the secretary, and the acting commissioner is also wearing the head of the food program hat. So I don't see that as making any material change. But look, they're going to be, virtually every member of Congress. I mean, members of Congress always have issues with FDA. An enormous percentage of them are going to be saying, how do I take advantage of this turmoil, uncertainty, change in leadership to press ahead? I didn't get anywhere with Makary. Maybe I can get somewhere with this new guy. I think you're going to see a lot of that.
Well, I wanted to transition to a question to Paul. Paul, just for everybody's sake, worked for Congressman Waxman, worked for Senator Kennedy as contrasted with Secretary Kennedy. So I repeat, Senator Kennedy. Looking at the present situation with the division in the Senate, any new commissioner has got to be confirmed by the Senate. You got Senator Cassidy in Louisiana in some apparent jeopardy. Today, look at the situation on Capitol Hill and what's going on there. What are people thinking, and what is the likelihood that we're going to be able to get a new commissioner confirmed by, before the next, after the midterms or this calendar year?
Yeah, certainly 210 days. And Stuart, you mentioned this takes us past the midterms, of course, and you won't pick a fight gratuitously, right, with the Senate on devising consent if you don't have to. But I think that there is real bipartisan concern about that decisional volatility, the whiplash that took place under Dr. Prasad, Dr. Makary. And, I think you would find so long as you weren't trying to completely satisfy the Maha crowd, you would find a candidate who had a lot of the hallmarks of the commissioners that we served. Managerial experience, professional expertise, and knowledge and recognition in their chosen field. And that I think is really important for the human drug side, just because we have two acting center directors, neither of whom have any experience with drug development or drug reviews, right? And so finding a commissioner who can speak that language and be in a position to mediate and manage, I think that's going to be critical, next year when this happens.
Right. And then final question for Stuart, and that is, for those who are not familiar with the process by which a commissioner is nominated and confirmed, and any other comments that you want to make in general, but I did want you to describe the process and how long it usually takes, because again, as with being at FDA, outside of FDA, we've been involved in that process together.
Yeah. Well, so the commissioner is subject to nomination by the president and approval by the advice and consent of the Senate. So sort of an interesting question I have is, can any of us conceive of any scenario? Suppose the perfect commissioner candidate presented himself on Monday. Could that person be confirmed between now and the midterms? And how does this play out? If you think the Democrats clearly have a shot at having the majority in the Senate, would require a lot of things to fall in place, but it's not a ridiculous notion. So if you don't nominate someone right away, if that person doesn't get considered by the Senate while it's under Republican control now, aren't you running a risk that you have to get someone through the Senate when it's under Democratic control? That's a really sort of tricky question. I think looking at the Senate calendar and everything else, I think even if the president nominated someone on Monday, it would have a 2% chance of getting considered between now and November. And so I think inevitably, so that's why Kyle may be the acting commissioner, through the end of the year. I mean,
Yeah.
and at some point, being a caretaker, he'll have to switch out of being a caretaker if that's the case. And I don't know him well enough to know whether he thinks he might be. He's already the first lawyer to hold the commissioner's seat on any basis, full-time or acting. I don't know whether he thinks, if he performs well, he has a chance of getting nominated. I view that as a long shot, because I think at the end of the day, a majority of the senators believe that the commissioner needs to either be a medical doctor or have a PhD in a biological science field, and as capable of lawyers are at doing lots of things, they don't have medical degrees or PhDs in biology.
On that note, let me thank you both, Paul Kim and Stuart Pape, for agreeing to do this podcast on such short notice, and for being so insightful. I know it's something that's very important to the future of food and drug regulation and to FDA. So thank you both. We'll have you both back and see whether any of your predictions have any merit at all. Okay? We'll do that in the future. And I just want to remind our audience that we will continue to examine what's going on at the FDA and to be in close touch with the leadership of the agency and with what's going on there. And as I say at the end of every episode of FDA Watch, if you want to watch what's going on at the FDA, listen to FDA Watch. This is Wayne Pines.